Well, we've been having some forums for our employees. This is about a strategic plan that we've been working on and developing. We've had conversations with our board of directors about things. And what I would like to talk about with you guys a little bit, is some of the things that have been happening, some of the trends we've been seeing both locally and nationally, and how they're affecting healthcare in general and regional West in particular, and what we're going to do about those things. So that's really what I'd like to talk about. Trends with providers and trends with the economy and healthcare reform in general. With demographics, I'm sure you're all aware there's been a slow decline in the population in the Panhandle over the last couple decades. It's quite slow, averaging about 0.1% per year, but it is slightly decreasing. And that comes at the same time as pretty rapid growth in surrounding areas, to the south especially, but also western South Dakota. This has resulted in what we could call a growing capability gap between regional West and large neighboring facilities, where years ago, if you needed something that wasn't available here, you'd have to go at least to Denver to get it, and people went much further. Now that's really not the case. You can get things in Cheyenne and Fort Collins, Greeley, Loveland, Rapid City that are not available here. Our organization grew as a referral center, and this difference in capabilities is having an impact on what's happening here. So you combine the demographics and this sort of capability gap, we're seeing that contributes a lot to what we're seeing in terms of our volumes here. We've had a pretty significant decline in volume over the last 18 months, and that's a big part of it. At the same time, well, not at the same time, over the last probably 10, 15, 20 years, physicians have changed a lot in healthcare. They've become much more mobile than they ever were before. When I came out of medical school, the deal was you went into practice someplace and you stayed there until you died. And that doesn't happen anymore. People come out of training and they may have 3 or 4 or 5 different locations in a career. That's very different from what it used to be. There are a couple things driving that. In the really small communities where there are 1 or 2 or 3 physicians, a lot of times what we see is physicians who have graduated with a degree from outside the U.S. or are foreign residents who have requirements to fulfill a visa. They can do that in small rural communities, but they tend not to stay there for very long after that. But there's been a trend towards increasing turnover among physicians for a long time. There's also a growing interest from outside systems on what happens in the Panhandle that we haven't seen before. So some of these larger systems are paying a lot more attention to what's happening here. The implications of all of this is that it's more difficult to establish and maintain the relationships that we've always counted on for our outreach programs. And there are some other systems in the region that are contemplating a change in control, that is, hooking up with some other system. And those things further threaten our patient base. Nationwide, healthcare and the economy and healthcare reform are also big issues. There's a lot of financial stress on consumers. We're pretty aware of that. Employers and payers are driving changes in benefits plans. There are a lot more high deductible health plans today than there ever have been. And there's a growing recognition of the value of what we're calling population health management, where it really changed the focus of healthcare. I think the national slowdown in healthcare services is likely to persist, and along with that, there's a continued downward pressure on payments that we've received. So all of those things add up to some pretty significant issues for us. Reduced volume, both inpatient and outpatient, reduced payments, and the resulting reduction in our financial performance. Now, we're not broke. I don't want you to go away here thinking that we're declaring bankruptcy or anything like that, because that is not at all what's happening. But these are things that our board has to be aware of and look at pretty carefully. If you would like, we can talk about how I think healthcare will change from where it is today to where it will be 5 or 10 years from today. But I think I can make a pretty confident forecast that it's going to be very, very different 10 years from today than it is today. And I've been in this pretty intensely for a long time. I can think back 10 years, it's way different today than it was 10 years ago. But the changes we're seeing now, the pace of change is more rapid than at any time in my career, which now goes back longer than I want to end up. So those are big factors. So our board has looked at some responses to this. A year and a half ago, we had a board retreat where we considered the question, should we affiliate with a larger organization? If we should, what should it be? Who should it be? We took that question up again early this year and in fact appointed an affiliation task force of the board of directors to study it more carefully. And they identified 3 main options. These revolve around affiliations with a larger system, first with a change in control, which means basically that the ultimate decisions about what happens in healthcare here would no longer be made by a board of directors that is located here, be made by a board somewhere else. So that's a change in control type affiliation. Affiliations with other systems without a change in control. We already have several of those, as you probably know. We are a part owner of Medical Center of the Rockies in Loveland, Colorado. That's an affiliation. We have an affiliation with Nebraska Medical Center, the Buffett Cancer Treatment Center. We expect that we will broaden those kinds of affiliations in any case. And then there's a third kind of affiliation that's kind of atypical, which would be the idea of connecting with a payer. That's actually a pretty interesting idea. And the board then asked the question, what would it take to retain local control, local governance control? What would we have to do that? So we've identified a number of strategic priorities. These deal with patient safety. We've been working really hard on patient safety for the last couple of years, and we've made substantial improvements. Our goal is to be at a 0 serious safety event rate by the end of 2014, and to maintain 0 into the future. We are working hard on improving the patient experience of care. We think that's a really important thing. We have to prepare for population health management. Talked a little bit about that before. It requires a wide range of different competencies to do that. We have the physician's clinic and the medical center that are currently separate corporate entities, and we think we need to merge those into a single entity, and we need to remove a sizable sum of money from our expenses. So we're talking about $20 million, which amounts to 8% of our total expenses. That's pretty consistent with what we're seeing in other places in the country. About 6 weeks ago, I think there was an article in the Omaha World Herald about the hospitals in Omaha. Pretty much every one of them is trying to take 10% of their expenses out. So at Nebraska Medical Center, for example, I think amounts to close to $100 million. So there's a lot of attention on this nationwide, and we're certainly not unique in that. So we've gone through a process of revising the mission, vision, and value statements. We can make those available to you later on. I don't need to read through those right now, I don't think, unless you'd like me to. But and then What we've talked about with our employees and what our board has agreed to is that we have a number of things that we want to accomplish in the near term, and we have some other things to deal with long term. So we mentioned about consolidating the physician's clinic and the hospital into a single corporation. That will enable us to do some other things, specifically with how we purchase pharmaceutical agents and how we can purchase those things for a lower cost. We're revising our employee health plan a little bit. It will still be a strong plan, but it'll be a little bit different. I mentioned high deductible health plans. We're no different from other employers. We have a need to control health plan costs, and so we've had a high deductible health plan for several years, but we've also had more traditional options, and next year we'll just have the high deductible health plan for everybody who wants health coverage here. And we've been working on making access to care easier. The focus so far has been in the primary care clinic, but that will broaden. So we know that we need to get easier for people to use. We have a couple other things like replacing our information technology system, electronic health records. That's a big task. And one of the things the board asked me to do was to figure out a succession plan, because they recognize, as I certainly do, that I'm not a pup anymore. I've been at this for a long time, and I'm dedicated to the organization, but I'd rather not die here right now, at least not die in my job. So I've announced that I will retire at the end of 2014. We're going to recruit a chief operating officer, a president and chief operating officer. We hope this person will be on board sometime around the middle of next year. And whoever this person is and I will work together for several months to make the transition as smooth as we can, and then I'll depart, and the idea is that this person will then become the president and CEO of Regional West Health Services. And we're supposed to have all of this done by April 1st of next year. So we got a lot to do between now and then, but we think we can get that done. After that, we've got to figure out how we're going to get the remainder of the $20 million out of our expenses. We believe that if we can accomplish that by the end of 2015, that will really put us on a very strong footing for the long-term future.